with more lockdowns looming and other heavy pandemic measures in place around the country, we're talking again this morning about the impact on Canadians' mental health. So for more on that, we're joined by Christine Purdon. She is a professor of psychology at the University of Waterloo and a registered psychologist in Kitchener, Ontario. Dr. Purdon, thanks so much for joining us. Let's talk about this. We're descending into winter. It's getting darker and colder. Fewer social opportunities, if any, really, for so many today. Let's talk about how this is going to have an effect on those already, before all this, who were dealing with mental health issues.
Mm-hmm. So I think it's an excellent question because the COVID has brought so many stressors, and we do know that stress is associated with onset of symptoms as well as increasing symptoms in people who already had them. So I do think it's, excuse me, I do think it's a concern. I think that the isolation, the darkness, and the feeling a bit out of control with things being locked down around you, as well as the sort of scariness of lockdown, could potentially exacerbate problems in people who already are having difficulties.
Are people who may have had issues in the past and successfully developed ways of managing them, and maybe, as you say, experiencing further stressors now, are the resources available to them in the same way, or are there restrictions as a result of the pandemic?
Actually, one of the, I don't like to say, good things, but something that is an advantage at this time is because of the lockdown, a lot of mental health services have moved to telepsychology. So instead of needing to go into an office, people can now access services through their own computer. So I think that in some ways, mental health resources are more available, although it presumes that the person has good internet, they have a computer they can use, and they have the privacy they need. And I think those are issues that we really need to be paying a lot more attention to. And I think we need to be making sure that we're getting really good internet out to all areas of Canada, because I know some communities just don't have the internet that would be required for telepsychology.
Another factor in this may well be sleep. People are finding their natural rhythms, their work disrupted. They're maybe not getting the sleep that they have become used to. How let's go back to meat and potatoes here. How important is a good night's sleep?
Yeah, so a good night's sleep is important. And I think that one of the things that we're definitely seeing is an increase in insomnia and difficulty sleeping. And that could be for a variety of reasons. One is that if we're feeling stressed, we can get into bed and then immediately the brain says, oh, what about this? What about that? Which are not the conditions to fall asleep in. Secondly, there is an increase in substance use and alcohol use during the pandemic. Alcohol definitely interferes with sleep. And thirdly, a lot of mental health problems are just associated with insomnia. So in depression, for example, people may have a lot of difficulty falling asleep or staying asleep. So a good night's sleep is actually a really good thing to get. But at the same time, one of the reasons for insomnia is that people put so much pressure on themselves to get to sleep. So I think that what we want to do is help people become more educated about how to get healthy sleep and what we call sleep hygiene, which means really regular bedtime and getting up time, regardless of how much actual sleep you got in between. And when you're lying in bed not sleeping, you get out of bed and do something else until you're very tired again, and then get back into bed, so that the bed itself doesn't become a cue for that anxiety and stress.
For those who may not know they are approaching a depressive state, or it's creeping back from years past, what should they focus on? What do they need to be aware of?
Yeah, so I think if you've had a history of depression, we do know that statistics indicate that you're more vulnerable to having another episode. And it is really important to be tracking both your mental and behavioral state. So if people who are finding themselves slipping into a lot of rumination, so a lot of really negative round and round and round about things that they feel they haven't done well, things they've failed at, things that they don't understand why it didn't work out, and they're locked into that rumination, we need to help people disengage from that and move into doing switching their mindset from that negativity to something constructive and productive. And then behaviorally, depression is associated with inactivity. And what people need to do if they're finding themselves sort of just staying in their pajamas or not showering and not getting out of bed, structuring your day, making sure every day out of bed, showered, dressed, 3 meals a day is absolutely critical. So just keeping stock of what am I doing and what am I thinking about during the day, and making sure you're doing constructive, productive things both mentally and physically.
That need to be stimulated, to have a regular routine is important as well for those suffering from dementia and with the isolation, especially in long-term care, but really so many in so many environments not exposed to the usual people, the usual stimulations that they need so much. What can we do about that?
Yeah, it's a heartbreaking problem. I think that we want to be able to use technology to the best of our ability, because often that's the only way we can access our loved ones in care homes is through technology. And so I think trying to find some creative ways to engage them, so putting together a playlist of music that they grew up with, that they can listen to, put together, like get your group together, sing some songs and send them a recording of that. Anything you can do to try to engage and distract and give people something to do would be quite wonderful. So even if you're not able to actually do FaceTime, maybe you can send some songs or something, or a playlist, et cetera, to somebody inside the home who can help them.
Dr. Purdon, just a few seconds left, but I did want to ask this one more question. How concerned are you about the negative legacy of this being increased mental health issues that may last for years? I think we need to always remember that we're very resilient as a species. We survive mental illness and mental health problems are by the exception, they're not the norm. I think that there will be some ripple effects once we get back to normal, because people will have to readjust again. But I'm not so worried about an epidemic of mental illness. Okay, a little good news there. Thank you so much, Dr. Purdon. Really appreciate it.
Thank you. My pleasure. Thank you.
In Kitchener, Ontario, professor and psychologist Christine Purdon.